You've tried pills, you've tried exercise, maybe you've even tried therapy, and yet your fibromyalgia still feels like someone turned your pain system to maximum volume and snapped the knob off. So when you see headlines about magnetic brain stimulation erasing pain, vagus nerve devices resetting the nervous system, or electrical suits giving instant relief, it's tempting to think, maybe this is finally the thing I've been missing. In this video, I want to show you what neuromodulation actually is: TMS, tDCS, vagus nerve stimulation, tENS. What real studies in fibromyalgia say, where these treatments might help and where they're mostly hype. Not to sell you a device, but so that if you ever consider one, you'll walk in with your eyes open and with your 3 pillars still at the center of your plan. My goal is not to convince you to chase a brain device, and it's not to tell you they're all useless. My goal is to help you understand what neuromodulation can and cannot do, so if you ever consider it, you walk into that decision with your eyes open. And before we go any further, the important reminder: this video is education, not personal medical advice. I don't know your full medical history, your medications, or your other conditions. Please don't start or stop any treatment, including devices or procedures, without talking to a qualified professional who knows you. Think of this as a map of the neuromodulation landscape for fibromyalgia, not a prescription pad. Let's start with a simple question. What is neuromodulation in plain English? Fibromyalgia is often described as a central sensitization condition. In simple terms, the volume knob on your pain system is turned up too high. Signals that should be interpreted as mild are experienced as loud. Your brain and spinal cord are involved, not just your muscles and joints. Neuromodulation is a family of treatments that tries to change how those pain networks fire. It can work from the outside in, with magnets or weak electrical currents applied on the scalp or skin, or from the inside out, with implanted devices. The goal is always the same: adjust the nervous system's patterns so pain signals are processed differently. You can think of your pain system like a music playlist that's gotten stuck on maximum volume repeat. Neuromodulation tries to nudge the system into playing at a more reasonable volume again, or at least make it easier for other treatments like exercise and CBT to have an effect. The main approaches people with fibromyalgia hear about today are transcranial magnetic stimulation, or TMS, transcranial direct current stimulation, tDCS, vagus nerve stimulation, VNS, both implanted and non-invasive, and more traditional electrical techniques like tENS and full-body solution suits. We're going to walk through each one: what it is, what the evidence looks like in fibromyalgia, and how it fits into the bigger picture. Let's start with the one you've probably heard the most about: TMS. Transcranial magnetic stimulation uses a magnetic coil placed on the scalp to deliver short pulses of magnetic fields into specific brain regions. Those pulses generate small electrical currents that can increase or decrease activity in targeted areas over time. It's already approved in many countries for major depression, and there's growing interest in chronic pain conditions. In fibromyalgia, TMS is usually aimed at 2 main brain targets: the primary motor cortex, an area involved in processing movement and pain, and the prefrontal cortex, which is involved in mood, attention, and how we interpret pain signals. Most protocols involve multiple sessions per week, often 10 to 20 sessions or more, delivered over several weeks. Sessions are done in a clinic. You sit in a chair, a coil rests against your head, you feel tapping sensations and hear clicking sounds as the machine fires. So, does it help? Several randomized controlled trials and meta-analyses suggest that repetitive TMS, especially when used as an add-on to standard care, can reduce pain intensity and improve quality of life in people with fibromyalgia, at least over the short to medium term. Some studies targeting the motor cortex found pain reductions that lasted for weeks after the treatment course. Others targeting frontal areas also reported improvements in mood and cognitive symptoms. A recent trial in women with fibromyalgia used motor cortex TMS on top of usual treatment and found that pain decreased significantly for up to about 8 weeks, while some functional gains persisted longer during a maintenance phase. But there are important buts. First, the effects, while real, are not a cure.
Most studies show modest to moderate improvements in pain and function, not complete remission. For some patients, that's still a big deal. Going from unbearable to more manageable can change a life, but it's not the same as erasing fibromyalgia. Second, the benefits often fade with time. Many people need maintenance sessions to keep the gains, and we still don't have perfect data on how best to schedule those long-term. Third, access and cost can be big barriers. TMS requires specialized equipment, trained clinicians, and multiple clinic visits. Insurance coverage for fibromyalgia indications is often limited or absent because many health systems still see TMS for fibromyalgia as experimental rather than standard of care. What about side effects? Most TMS studies in fibromyalgia report that treatment is generally well tolerated. Common short-term side effects include scalp discomfort, headache, fatigue, or mild dizziness after sessions. Very rarely, TMS can trigger a seizure, especially in people with certain risk factors, which is why screening and proper protocols are essential. So, if we put TMS into one sentence for fibromyalgia, it would sound like this: promising non-invasive brain stimulation that can reduce pain and improve function for some people when used as an add-on, but not a guaranteed fix, not cheap, and still considered a second or third line option in many guidelines. Now let's move to a quieter cousin of TMS, tDCS, Transcranial Direct Current Stimulation. Instead of using magnetic pulses, tDCS uses a very low-intensity electrical current delivered through small sponge electrodes placed on the scalp. It doesn't zap the brain like a movie scene. Most people feel a mild tingling, itching, or warmth under the electrodes when the current is turned on. In fibromyalgia, tDCS often targets the same areas, the primary motor cortex and sometimes frontal regions. The idea is to gently increase or decrease excitability in these brain areas over repeated sessions, nudging pain networks to behave differently. What does the evidence say? Several randomized controlled trials have looked at tDCS in fibromyalgia, and when you put those results together, a consistent pattern appears. Active tDCS tends to reduce pain intensity more than sham or placebo stimulation, with some improvements in fatigue and quality of life, especially when combined with other treatments like exercise and mind-body therapy or medications where appropriate. One trial, for example, tested home-based anodal tDCS combined with exercise and pain education versus sham tDCS, plus the same exercise and pain education program. Women in the active tDCS group had greater reductions in pain-related disability and better pain modulation than the sham group, particularly among those who were more responsive to placebo-like effects, reminding us that expectation and context always matter in chronic pain treatment. Other studies pairing tDCS with functional exercise or medications have also shown improvements in pain, mood, and function compared with control conditions, though sample sizes are often small and methods vary. So tDCS, like TMS, looks promising, but again, not miraculous. The potential advantages of tDCS are that it's relatively low cost, has a good short-term safety profile, and in some protocols can even be delivered at home after proper training under medical supervision. Common side effects are usually mild, scalp tingling, itching, or redness. The limitations are similar too: modest average benefits, variability from person to person, and a research base that is still evolving. Different studies use different electrode placements, intensities, and session numbers, making it hard to define the perfect protocol.
Most experts today would place tDCS in the same category as TMS for fibromyalgia, an interesting, scientifically grounded approach that may be valuable for some people, especially when other treatments haven't helped enough, but not a replacement for the core pillars of exercise, mind-body therapy, and medications where appropriate. Now, let's talk about the vagus nerve, the star of a lot of social media hype. The vagus nerve is a major highway connecting your brain to many organs. It helps regulate heart rate, digestion, inflammation, and aspects of the stress response. Since fibromyalgia seems to involve both central sensitization and autonomic nervous system imbalance, it makes sense that researchers have asked, if we can tune the vagus nerve, can we calm the system and reduce pain? There are two main ways people talk about vagus nerve stimulation, or VNS. One is the traditional implanted version. This involves a surgical procedure to place a device under the skin of the chest with a wire wrapped around the vagus nerve in the neck.
The device delivers periodic electrical pulses. This kind of VNS is approved for conditions like epilepsy and treatment-resistant depression in some countries. Years ago, an open-label Phase 1/2 trial looked at implanted VNS in people with treatment-resistant fibromyalgia. The main goal was to see if it was safe and tolerable. The results suggested that VNS could be delivered safely to this population, and there were hints of improvement in pain and global symptoms for some participants. But the study was small, not blinded, and designed more for safety than definitive proof of benefit. More recently, researchers have turned to less invasive ways of stimulating the vagus nerve, especially through the skin of the ear or neck. This is called transcutaneous VNS, or tVNS, and it uses surface electrodes instead of surgery. Several clinical trials are now investigating tVNS in fibromyalgia, including cervical stimulation and auricular, or ear-based stimulation. Early pilot studies and ongoing trials suggest that tVNS may improve pain, autonomic function, and psychological symptoms in some patients, but the data are still limited and protocols vary widely. So what can we honestly say about VNS right now? Implanted VNS is a serious invasive procedure. For fibromyalgia alone, it remains experimental and is typically reserved for research or very select cases where other approved indications, like epilepsy or severe depression, are present. It is not a standard fibromyalgia treatment. Non-invasive tVNS is much more appealing because it avoids surgery, but it is still very much in the research phase for fibromyalgia. Some trials are promising, but we need more high-quality, independent studies before anyone can claim that tVNS is a proven routine therapy for this condition. There's also a practical concern. The market is now full of consumer devices that claim to stimulate the vagus nerve through the ear or neck for everything from anxiety to gut health to chronic pain. Some may be based on real neuromodulation principles. Others may be little more than rebranded TENS units with clever marketing. Experts have warned that for many of these consumer gadgets, there's limited evidence that they truly stimulate the vagus nerve in a controlled, therapeutic way. That doesn't mean all non-invasive VNS is a scam. There are legitimate medical-grade devices under study, but it does mean you should approach any big claims with caution and always involve a clinician when considering this route. Now, what about the more old-school electrical methods, like TENS? Transcutaneous electrical nerve stimulation, or TENS, uses small electrodes placed on the skin to deliver low-voltage electrical pulses, usually over painful areas or along nerves. It's been around for decades, and many chronic pain patients have at least tried it. In fibromyalgia, studies of TENS and related electrical neuromodulation methods have been mixed, but a recent meta-analysis that looked at different electrical techniques, including TENS and tDCS, found that overall, electrical neuromodulation significantly improved pain, depression, and function compared with control conditions. TENS, when used in structured protocols, appeared to help some patients reduce pain intensity and disability,
though again, not everyone responded. We also now see more full-body neuromodulation tools, like suits that deliver electrical stimulation to multiple muscle groups at once. One study compared a neuromodulation suit to a structured exercise program in fibromyalgia and looked at pain modulation and other outcomes. These kinds of approaches are interesting, but they're still early, often expensive, and not widely available outside of research or specialized centers. So, stepping back from the details, what does the big picture of neuromodulation in fibromyalgia look like? First, the science is real. Neuromodulation isn't just a buzzword. There is solid evidence that non-invasive brain stimulation like TMS and tDCS, as well as some forms of electrical nerve stimulation, can reduce pain and improve function in fibromyalgia, especially when used as add-ons to other treatments. Second, the benefits are generally modest to moderate, not miraculous. Most people don't go from severe pain to zero. Instead, they may see meaningful but partial improvements, enough to move from barely coping to managing a bit better, which can still be very important. Third, the research is still evolving. Many studies have small sample sizes, different stimulation sites, different dosages, and different outcome measures. We need more large, well-controlled trials to refine who benefits most, which protocols work best, and how long the benefits last.
That's why most expert consensus statements still classify neuromodulation as a promising but not first-line treatment in fibromyalgia. Fourth, access, cost, and practicality matter. TMS requires clinic visits and equipment. tDCS and tVNS can sometimes be done at home but require proper guidance and supervision. VNS, especially the implanted kind, is major and invasive. Full-body suits are not exactly something most people can keep in their bedroom closet. So where does that leave you, the person who might be watching this after trying multiple medications, working hard on exercise and pacing, and still feeling like your pain and fatigue are running the show? Here's one way to think about it. The three pillars we talked about, movement, mind-body strategies, and medications, are still the foundation. They have the strongest evidence base, they're included in every major guideline, and they're the things that most people should at least be offered. Neuromodulation sits on the next ring out. It's something to consider if you've worked seriously over time on those core pillars. You've optimized medications as much as you and your doctor feel is reasonable. You've given exercise and mind-body approaches a genuine chance, and you're still dealing with a level of pain and disability that feels unacceptable. In that situation, neuromodulation, TMS, tDCS, perhaps tVNS or structured tENS, can be framed as a potential add-on, not a replacement. The conversation with your clinician might sound like this. We've tried medications, exercise, and CBT-style approaches, and I'm still struggling. I've read that brain stimulation and vagus nerve approaches are being studied in fibromyalgia. Are there any reputable centers or clinical trials that might be appropriate for me? And realistically, what kind of gains would we be hoping for? If you do explore neuromodulation, it's helpful to treat it as a structured experiment, just like we talked about with PEA. Define your goals ahead of time. Less pain, better sleep, more ability to function in daily life. Track those things before, during, and after treatment. Be honest about what changes and what doesn't. And remember, neuromodulation works best as a part of a whole ecosystem, not as a standalone hero. A round of TMS may make it easier to participate in exercise. tDCS might help reduce pain enough that CBT techniques feel more possible. VNS might help regulate autonomic function in a way that supports sleep or stress management. None of these tools magically rewrites the story, but they can sometimes soften the edges of it. So here's the big takeaway. Neuromodulation in fibromyalgia is not science fiction, and it's not snake oil.
It's a rapidly evolving field where non-invasive brain stimulation like TMS and tDCS has real, though limited, evidence of benefit. Electrical techniques like tENS and full-body stimulation can help some people, especially when well-structured. VNS, especially the implanted kind, is major and invasive. Full-body suits are not exactly something most people can keep in their bedroom closet. So based on all this, before you commit time, money, and hope to any device, you can ask yourself 3 questions. Have I given the 3 pillars, movement, mind-body work, and medications, a fair chance? Is there a reputable clinician or research center involved, or is this just being sold directly to consumers with big promises? And if this helps me by, say, 20 or 30%, will that feel worth what I'm investing? If the answer to that last question is yes, then neuromodulation may have a role in your story. If this breakdown helped you make a little more sense of a very noisy topic, consider sharing it with someone who's being bombarded with ads and not sure what to believe. And if you want to keep exploring this fibromyalgia playlist, we'll continue doing exactly that, taking complex science, stripping away the hype, and turning it into something you can actually use. For now, I'll leave you with one more question. If you could turn down your pain system by even 1 notch, not erase it, just turn it down, what would be the very first thing in your life you'd want to do more of? You deserve more than miracle claims and more than nothing else can be done. You deserve clear information, realistic options, and a plan that respects both your nervous system and your real life right now.